The following are risk factors for heart disease that are taught at the NUTRILITE Health Institute.
The first risk factor for heart disease is family history. If you have a family history of heart disease, you're at an increased risk of developing heart disease as well. Secondly, high blood pressure. Hypertension accelerates heart disease by damaging blood vessels. A reduction of only 5 millimeters of mercury in blood pressure significantly reduces your risk of heart disease. When our heart pumps, it pushes blood into our arteries with a certain pressure, just like water in water pipes under high pressure, which results in pipes breaking. Our arteries actually get tiny cracks in them called microfissures. These microfissures are where the plaques form that harden our arteries. It's ideal to have a blood pressure that's below 115/75. Thirdly, smoking. All forms of smoking accelerate atherosclerosis or heart disease. Even secondhand smoke can be damaging. Next is depression. Depressed people who've had a heart attack are over twice as likely to die of a second heart attack compared to non-depressed heart attack survivors. There are several hormonal pathways linked to this risk factor involving epinephrine and cortisol. If you are struggling with depression or anxiety, you should seek help. For example, from your physician, religious counselor, etc. Next risk factor is lack of exercise. Exercise, even light exercise, significantly reduces the risk of heart disease. We don't recommend starting an exercise program, though, unless you've been cleared for your doctor to begin such a program. Risk factor number 6 is obesity. Obesity is defined in several ways. A BMI of over 25 for men and 30 for women, a percent body fat of over 22% for men and 25% for women, but a rough approximation is 35 pounds over your ideal body weight. The FDA and FTC define normal weight as a BMI of 20 to 24, overweight as a BMI from 25 to 30, and obese 30 plus, regardless of your sex. It has been found that excessive weight gain in Asians leads to greater health risks than the same amount of weight gain in those of European descent. As such, different BMIs are used to indicate overweight and obesity. Please remember that BMI or body mass index methods are only one of many indicators that can be used to determine your weight status. Some other examples are percent body fat or waist to hip ratio. Obesity accelerates heart disease, with abdominal obesity and distribution of fat being the worst form. Severe obesity, a BMI of over 45, may reduce lifespan in men as much as 22%. Next risk factor is diabetes. Both type 1 and type 2 diabetes accelerate heart disease. The World Health Organization states that there is an epidemic of diabetes in the world and is primarily related to our lifestyle. For instance, spending for diabetes has doubled in the US over the last 10 years and quadrupled during that same time period in Japan. Next risk factor is stress. Highly stressed people have increased rates of heart disease. Highly stressed people can stimulate hormone pathways similar to that of depressed people. The bottom line is that we need to reduce the stress in our lives. Next, elevated cholesterol and triglycerides. Both increased bad or LDL cholesterol and triglycerides contribute to plaque formation, which hardens and narrows our arteries. Next is elevated homocysteine. This amino acid is a breakdown product of protein. Perhaps as many as 10% of us have elevated homocysteine levels, with the main treatment being vitamin B supplementation. We recommend that everyone have their homocysteine blood level checked, and if elevated, they should talk with their doctor about taking 400 micrograms of folic acid, 2 milligrams of B6, and 6 micrograms of B12 per day. Next is lack of intrinsic or committed faith. Non-believers, or those with an extrinsic or uncommitted faith, have increased chronic health problems, including heart disease. Intrinsics, or those with committed religious faith, have decreased health problems. This is a fascinating area of study currently being done at Harvard and the National Institute of Health. Perhaps it is related to the same hormonal pathways involved with depression or stress, but it's currently unknown. Next is inadequate fruit and vegetable intake. Some studies indicate that 5 to 7 servings of fruits and vegetables daily may reduce the risk of heart disease as much as 50%. Hypothyroidism, or reduced ability of your thyroid gland to make hormone. This can be checked by your doctor. The final risk factor that we teach at NUTRILITE Health Institute is elevated C-reactive protein. This is a blood value that indicates some degree of inflammation. Remember, these risk factors aren't additive. They can even have a multiplicative relationship with one another.